Are you married or single, live alone, or with several other family members? A new study finds the answers to those questions may be the best way to determine your risk of catching COVID. Meg Ferris explains.
Back in spring and summer of 2020, when the original coronavirus was spreading, doctors at Ochsner and Pennington Biomedical Research Center took a look at who was most likely to catch the virus in New Orleans and Baton Rouge. In both cities, African Americans were twice as likely to become infected than people who are white.
African Americans are more likely to live in multi-generational households that predispose them to high circulation of this virus.
Kara Denstill, project manager for Population and Public Health Sciences at Pennington, says individual behavior makes a difference.
While where you lived mattered some, it was actually the individual level characteristics that accounted for most of the risk of infection.
So let's look at those individual characteristics. In New Orleans, the odds of infection were higher for Black adults and single adults. Risk for single adults was about 50% higher than for married people. It was higher for households with multiple people compared to those who lived alone, and higher for healthy people compared to those with pre-existing conditions like diabetes or heart disease.
People who did have underlying health issues, they stayed home. They were diligent about social distancing. They were diligent about wearing their masks. So that's why we see they actually had less risk.
In Baton Rouge, people more likely to be infected were people between 18 and 37 years old, Black adults, single adults, and people in healthcare or public-facing jobs, more so than people who worked in an office. And while the virus is changing, along with risk factors and our knowledge of how to treat it, the researchers say some original strategies still can make a difference.
Regardless of where we are in the pandemic, we can still do things to protect ourselves. Or wearing your mask, staying home when you're sick, getting vaccinated and boosted.
And getting tested to know if you're putting others at risk. Meg Ferris, Eyewitness News.
The study also found that people who live under one roof with many others are at higher risk for COVID, as well as people in lower income communities.